Hello, this is Dr. John McAllister, and I'm a dentist in Downey, California. Downey is about 10 miles south of Los Angeles, 10 miles south of Pasadena, 10 miles north of Long Beach. That's myself, and this practice started in the early 50s. That's Norma. She's been with the practice a little over 20 years. And you have Lisa, our hygienist. She's been with the practice a little over 30 years. Linda, registered dental assistant, 10 plus years. Jenny is another registered dental hygienist. She's been with the practice a little over 20 years. Then you have Sandra, a registered dental assistant, over 10 years. And Vivian, another registered dental assistant, 10 plus years. How do I serve you? If they're not in pain, why else? Because I want to keep my teeth. If you ask the right question to the patient and you ask them in the right way, they'll tell you. And what they want, but it's more than that. It's the personal satisfaction of helping the patient get rid of something that's eating them alive. It's an infection that's eating them alive, and those we all know that's the number one cause of tooth loss. And implants are great, but they're no panacea. We're seeing a lot of implants failing. And you look at the journals just a couple months ago, 6 months ago, both the Journal of American Dental Association and the Journal of Perio, JOP, both showed that there's up to 50% failure rate on periimplantitis cases. So implants are no panacea, and they're not anywhere as good as your natural teeth. So if you can keep your patient's teeth with a minimally invasive procedure, it's a win-win for them and for the practice, and it's a joy to help somebody beyond just their teeth, because we all know that it affects their health in general. There's study after study after study just showing how the correlation between gum disease, this infectious thing that's eating them alive, affects their health, and that plus saving their teeth, it's a win-win for the patients. Well, hello, I'm a dentist in Downey, and today we're going to be talking about the foundation of your practice. The foundation of all practices basically goes down to the patient, because by definition, a dentist without a patient is unemployed. It's like this photo here. If you take a look at any building in any city, what is a building without the people inside? A church without a priest? Synagogue without a rabbi? How about a courthouse without a judge or without a lawyer? Firehouse without a fireman? So the foundation of any dental practice is their patient base. So everything revolves about what they want. So if you ask your patients, as long as they're not in pain, what do they want? They usually want to keep their teeth. So it's important for every dentist to take that into consideration. The challenge is getting people to accept the treatment that we recommend. And today we're mostly going to be talking about periodontal disease. And one of the challenges that we have with periodontal disease is it doesn't hurt. It usually doesn't hurt until it's too late. So it's less likely for people to come in because of their pain. But if they do come in and they are in pain, well, we get them out of pain, and then we educate them, hopefully, and talk to them about their gums and their situation. Now, they're going to be a little possibly afraid of any treatment, especially for periodontal disease. In the past, it's been quite cruel and barbaric, and the cost. But the reality is we shouldn't consider the cost, but the value to the patient. And trust, well, that's something earned. And each one of us has to earn that each day and every day that we work with those patients. And it's critical. One of the critical things about the doctor-patient relationship is that nothing can get in the way. It is a sacred relationship, a relationship based on a fiduciary responsibility. That responsibility means that we have to put their interest above our own, and it's critical to do that. One of the challenges that comes up is we have to look at the big picture. First, the patient comes in, we do an evaluation, hopefully we take a full series of x-rays, a full series of photography, and a full periodontal charting, and that's critical for a good diagnosis. Then we listen to the patient. What are their interests and concerns? And what have they had done in the past, and how was their experience? Then we have to be on top of the scientific literature and understand what's coming out in the peer-reviewed literature. And then our own experience and judgment. And that all plays a role. And what's important is to kind of come to an understanding with the patient. One thing I'll recommend is never allow yourself to fall into completely patient's preferences and values. I've found that a lot of times that if I allow this to happen, I end up hurting the patient more than helping them. So if a patient tries to pull me too far over here, I'll just tell them that maybe I'm not the right dentist for them. Periodontal disease, that's what we're going to talk about today. It is the #1 cause of tooth loss in adult Americans. Very common. Consider edentulous. How many people in the United States don't have teeth? About 1/3, 30% of Americans over 65 don't have any teeth. That's tragic because one of the things I've found is that no matter how good of a denture I make, it's never quite as good as their natural teeth. The biting force is about 1/10. And patients who come in and they tell us, oh, just pull out all my teeth, those are the ones that I recommend they see somebody else. Unless it's just so far gone and there's nothing I can do. Because the reality is, my most grateful patients are the patients who have no teeth and are in dentures, and we place a couple implants and we snap in their teeth and they're just snapped in. And that joy that those patients receive, my objective is that my patients, rest of my patients, never experience that joy by actually just keeping their natural teeth. And since gum disease is the #1 cause of tooth loss, all our foundation of all our dentistry, all the dentistry that we do is based on gums, periodontal health. Because you could do the most beautiful veneer case and most beautiful reconstruction, but if the periodontal health is not there, then you're going to lose the whole case. The other challenge, and this is a significant challenge, is that patients are having this condition and it's actually leaching into their system, and it's causing a systemic disease process. More and more, there are journals in the literature that show that there's a correlation between gum disease and heart disease, gum disease and low birth weight babies, gum disease and stroke, gum disease, and it just goes on and on. On my website, if you take a look, there's over 100 citations in the medical and dental journals showing the correlation between gum disease and your health.
Stacy Wu markets her own fashion line,
Keep that on the table.
all while taking care of her son Duke and preparing for the one on the way. But it's what happened to her first child, Stella, that changed the fabric of her life.
I woke up feeling the baby kick, and then mid-morning I said to my husband, I don't feel the baby moving that much.
Just a week before her due date, Stacy lost her little girl. An autopsy revealed an oral bacteria found in Stacy's mouth was the same strain discovered in her baby's stomach and lungs.
The big mystery to me was, how did it get into the placenta, and how did it affect the baby?
Doctors believe the bacteria spread through the mother's bloodstream to the placenta. Stacy's is the first recorded case of gum disease linked to the death of a full-term baby. But half of all pregnant women are at risk and suffer from bleeding gums, a condition known as pregnancy gingivitis.
Especially as a mother of three, it is a real concern in my heart and mind to be mindful of this for my patients who would be pregnant and suffer from periodontal disease.
Dr. Bloor says it can be treated with a newer, faster, safer, and cheaper way with a single trip to the dentist. This new laser called Periolase targets diseased tissue and kills bacteria.
It's like a guided missile for bad stuff in the mouth, and it removes the infected material.
Usually dentists will cut open and scrape the gums, but with this new laser, none of that is necessary. And there's no risk of an accidental cut sending that bacteria into the bloodstream.
We have the ability to reach out into the tissues and kill the bugs versus just sort of scraping the lining of the tissue or the tooth.
You can see how it works, taking off the ink from this bottle without harming the glass. Now pregnant again, Stacy is more vigilant about the health of her mouth and optimistic about her future.
I'm ready for whatever comes our way. We've conquered some serious hurdles.
Cynthia Gould, CBS 42 News.
Again, a very tragic situation and something that could be avoided. Aetna Medical and Columbia University found that periodontal treatment reduced overall medical care costs by up to 9% for diabetics, 16% for coronary artery disease, and 11% for stroke patients. Those are big numbers for somebody like Aetna. If you consider if they have over 1 million people enrolled with their medical plan. The other one, United Concordia, came out with pretty much the similar numbers, but really these are just percentages of costs. It doesn't take into consideration the trauma to the patient who has to go undergo medical procedures and have to go into the hospital, and all the negative consequences these serious diseases have on a person. Again, medical insurance only cares about the cost savings to them, so this is important to them. But the reality is it's not about the cost, it's about the patient and their quality of life.
Researchers have discovered that if you have periodontal disease, you may have an increased risk of coronary heart disease, stroke, and infective endocarditis. Periodontal disease is an infection of the teeth, gums, and bone that surrounds your teeth. It's caused by the bacteria that live in the plaque that forms constantly on your teeth. The bacteria infect the tooth roots and cause pockets of infection to form in the gums, resulting in red and swollen gums that bleed when you brush or floss. Even with early periodontal disease, bleeding gums can create an open doorway that allows harmful bacteria to enter your bloodstream. More advanced periodontal disease can be even worse. It can be compared to a 9 square inch open wound around your teeth, offering significant opportunity for harmful bacteria to enter your blood. Research indicates that the bacteria associated with periodontal disease may cause inflammation in the arteries, and this could lead to the buildup of fatty deposits and the formation of blood clots that can block your arteries and even trigger a heart attack. These deposits may also build up in the carotid arteries within your neck. In serious cases, if these fat deposits break apart and are carried away in your bloodstream, they can lodge in your brain, block a blood vessel, and cause a stroke. Additionally, some studies have also shown that when plaque bacteria enter the bloodstream through infected gums, you can develop a heart condition called infective endocarditis. This is a potentially fatal bacterial infection that inflames the sac around the heart, the valves of the heart, and the heart muscle itself. So as you can see, it's vital to your overall health, as well as your oral health, to keep your gums healthy. If we determine that you have periodontal disease, we'll see you for frequent professional cleanings and will work with you to create a suitable oral hygiene routine.
The challenge, though, is that unfortunately most dentists don't diagnose the situation. This is a statistic according to the American Dental Association that 16% of dentists probe their patients yearly at 6-point probing. That's tragic in the sense that if you consider if you're not diagnosing it, well, you're not going to treat it. You basically ignore the number one cause of tooth loss. So yes, we are our own worst enemy if you consider that patients come to us because they want to, unless they're in pain, they want you to help them to keep their teeth. Well, if they want you to help them keep their teeth, don't you think at least diagnosing the condition with the number one cause of tooth loss would be important? I would hope so. So now we have a procedure that reverses the condition according to the FDA. It's called LANAP. And
Tenaman isn't the only way to help control urine leakage. Try pelvic floor exercises. Simply clench.
What is LANAP? LANAP is an acronym for Laser-Assisted New Attachment Procedure. LANAP is the no-cut, no-sew laser alternative to flap osseous gum surgery. The procedure is for people who have gum disease, also known as early, moderate, and severe periodontitis. How do you know if you have gum disease? Some signs of gum disease are bad breath, bleeding when brushing or flossing. For an accurate diagnosis, see a dentist and they have to take a full series of x-rays and evaluate the bone support around your teeth. Then, and this is critically important, you need to have your gums evaluated and 6 measurements per tooth need to be made with a periodontal probe. The instrument is placed between your gum and your tooth and a measurement is taken in millimeters. Healthy numbers are 1, 2, and 3 millimeters. Anything greater than 3 and bleeding, then this is a sign of gum disease. If your dentist does not take these measurements, it is time to find a new dentist. Gum disease is responsible for being the number one cause of tooth loss. Consider in the United States, 1/3 of Americans over 65 have no teeth. Most of them lost their teeth to gum disease. LANAP has FDA clearance to reverse gum disease. The laser procedure, unlike traditional gum surgery, requires no cutting or amputating of the gums. Since the tissue is not amputated nor peeled off the bone, no sutures are needed. Patients who have gone through treatment usually say the day after and a week after that they have about a 2 on a pain scale of 1 to 10. To see several video testimonials, visit lasergumdentist.com and click on the Testimonial tab. LANAP is done with the Periolase laser. Don't be fooled by anyone that uses a different laser and claims to do LANAP. Buyer beware. To see some remarkable cases, visit our website and click on the Before and After page. We have also included the cost to have the procedure done. Visit us at lasergumdentist.com.
These are some videos of some periodontists, very distinguished periodontists. Most of them have had at least 20 years experience of being a periodontist.
Halitophobia, the irrational...
I mean, now it's a fun for you to take care of it. Whereas, expand on that. What do you mean by that?
You know, the treatment of periodontal disease has really changed dramatically in the 20 or so years that I've been a periodontist. When I finished my perio training, advanced periodontal disease was always treated with cut and stitch gum surgery. And people would do it because they wanted to keep their teeth, but nobody enjoyed doing it. No one thanked me for doing it when we were done.
Right.
And it was, although technically it was enjoyable to do, that's why a lot of people become periodontists, it's hard to enjoy doing it when you know that people weren't enjoying having it.
Okay, okay. So now this new laser has changed all that. I mean, is it really that different?
It's completely different
than the way it was before?
It's completely different. You know, before, when someone came in with advanced disease, they'd have a number of visits with a hygienist of scaling, 3 or 4 visits, and then they would have a number of visits of gum surgery, where we'd lift the gum up from around the teeth. I'll show you in a little bit. I have brought some pictures to show you. And now with the laser, we can reverse 20 years of neglect sometimes, or 20 years of disease in a couple 2-hour sessions.
So things like no more bleeding gums, no more loose teeth, no more bad breath. These, I mean, are these truths about what this laser can do?
Yeah, this,
I mean, not an exaggeration?
Not an exaggeration at all. This laser I found to be as effective or more effective at treating periodontal disease than was the old cut and stitch surgery.
Now, we should talk about your background in training. You're board certified periodontist. You're clinical professor, assistant clinical professor at New York University College of Dentistry?
Yes. What happens is the laser energy first goes into the pocket and it removes diseased tissue but leaves healthy tissue untouched. If I were to take the laser and move it over a piece of newsprint, it doesn't affect the paper at all, but it will remove the ink from the newsprint leaving the paper undisturbed. So the bacteria of periodontal disease soak up light energy very well. So the laser goes in, it kills those bacteria, and it removes the diseased tissue very selectively and doesn't touch healthy tissue at all. It's more precise than any surgeon's scalpel could ever be.
Okay, so the way it's been done, or being done nationwide, okay, is you go in, you cut it out. I mean, is that right? Or scrape it out?
In effect, what we would do is we would make an incision and lift the gum up from around the teeth. Once the gum is reflected, we could see the root of the tooth, and we would scrape the tartar off the root in a hope to remove the tartar, to remove the bacteria, and then we would put the gum back. So it was sort of removing it mechanically. But in order to remove it mechanically, it was very invasive. We'd have to open the gum and ultimately close the gum. And the act of, you know, cutting open the gum, reshaping the bone.
And that's the old way. We're talking about the old way.
Right.
But the old way is being done every day.
Right. And
right? Is that right? Even in Long Island?
It's being done everywhere. And, you know, what's interesting is people always have a quandary. Nobody wants to lose their teeth. No one comes in and says, well, I'm okay losing my teeth. Who would want to go to work, you know, see their spouse, meet their friends, and have half their teeth missing? Nobody.
Okay.
But people would be so hesitant to do periodontal surgery because they've heard horror stories from their friend or from their spouse that many people really make a conscious or unconscious decision to leave their gum disease untreated because they felt it would be, they'd rather lose their teeth than have that surgery done.
You have this laser treatment for the bleeding gums, bad breath, loose teeth, all those things. How soon can they be somewhat comfortable with their eating, chewing, things like that?
Well, they're comfortable right away. There's no, you know, 2 days ago I treated a gentleman in the morning and he went to work in the afternoon. So people take a Motrin or a Tylenol after treatment. They don't have the weeks and weeks of downtime or the longer downtime that cut and stitch surgery would have.
Are people traveling a long way to see you? Because you're the only guy that has the laser right?
You know, I'm amazed. People are coming from Montauk all the way on the East End, from New York City and everywhere in between, passing, you know, 30, 40 periodontists in between. And it sort of gets to my point that everybody wants to keep their teeth. Who in their right mind would make a conscious decision to lose their teeth? But if it means going through having periodontal surgery, a lot of people just don't want to do that. So it's sort of a way that you can have your cake and eat it too. You can treat your gum disease without having to have surgery.
So you say that there is an alternative than cutting and stitching for gum disease. What is it? You say lasers.
I'm a periodontist. I've been practicing for 2 decades. In the past, we would do deep cleaning, and then if that didn't work, we would go into something called periodontal surgery, which is where you're cutting the gum tissue and then having the suture. Now, patients, even though that may be very effective, patients didn't like it. It didn't provide them the comfort and the aesthetics that they're looking for. There's something called laser-assisted new attachment procedure, or commonly known as LANAP. I'm one of the few in the area, in the Philadelphia region, who's able to provide this for patients. It's a technique, it's a protocol. I'm using a laser, state-of-the-art laser, which is going to evaporate the bad bugs which cause this disease, and it's going to selectively remove the infected tissue. It's not like I have to go in with a knife.
So it's like a bacterial infection that is killed with the laser. Is that right?
I love it. So what causes this disease? Bacteria, bugs in the mouth. When patients hear that, they're like, oh my God, bugs in my mouth, get rid of it. So it's going to absolutely 100% eliminate the bug around the gum tissue and around the tooth. But secondly, this is where it's been so tough in the past. How do you selectively eliminate the infected tissue, or normal gum tissue that's been infected with bacteria, that's got this inflammation going on, without cutting the healthy stuff away? In the past, it was with a knife. Now I can go in with a laser, which looks like a little tiny wand, a tiny little fiber. It's the width of 3 hairs. I can go into the gum tissue, and the laser does all the work. It eliminates that infected tissue. It obliterates the bacteria.
So no more bleeding gums, bad breath?
No more bleeding gums, no more bad breath. Gum tissue looks red and healthy. And get this, not only does it eliminate it, it's actually going to regenerate bone, which is going to make the teeth stronger.
Okay.
And it's going to improve the quality of the gum tissue. It's going to look healthy. And like you said, we don't have the bad breath anymore. The teeth are starting to feel more comfortable.
So loose teeth feel better, they get stronger.
Bottom line.
So no more cutting, stitching, you say?
It's a thing of the past, Randy. We don't need to do that.
There's only less than 10% of periodontists that are using this laser,
the ones,
statistically.
Correct. We have about 10%. According to the American Academy of Periodontology, only 10% are using this. Those are the top 10%. 10 years ago, 20 years ago, nobody was using bone graft. Nobody was thinking ahead
so you love
about
this
regeneration. It is cutting edge. It is where everybody's going to be 5 years from now.
Okay, good.
And I'm forging that at this point.
What happens is, with periodontal disease, the bacteria stay there. So you have this chronic inflammation that just stays there. So what the laser does is it gets rid of the bacteria. It lowers the level of the bacteria so that the body's elements, the healing mechanisms, can be successful. And that's where the regeneration occurs, and the reattachment, and the connective tissue attachment. And this has been shown. This laser procedure is the only FDA-cleared laser for a patented protocol. Okay. This laser has been out for 10 years. It's the only company that actually has the histologic study that shows regeneration and reattachment.
So it works. I mean, it definitely works.
It works. It works for the patient, and the dentist cannot dispute the science.
But it's also made your job a lot easier, you said. You know, in the old days, you would do the cutting procedure for gum disease, which is done, by the way, in Chicago every day. Is that
every
true?
day, all across the country.
Like hundreds and hundreds, though, in Chicago alone?
Yes. I mean, periodontal disease is worldwide,
okay,
but
so
yes, in
no
Chicago.
more cutting. I mean, you shouldn't have to do it with this new laser.
Correct.
Okay. So, but you say in the old days you would do one side of the mouth.
Right.
And you couldn't even get them back in for the other. Elaborate on that.
Well, of course, I wish I could say all my patients came back for the other half, but often after that first experience, patients prefer not to finish. As a matter of fact, the first year I had my laser was the worst of the recession. I had my best year in business because all of my patients in my practice that had refused surgical care accepted the laser treatment.
Here's one in treating gum disease?
Over the last 10 years now, I've been using a procedure known as LANAP that uses a laser to treat moderate and severe periodontitis in lieu of using a scalpel and stitches. Okay. Sometimes there are changes in the spaces between your teeth, which indicate changes in the underlying bone. In fact,
so the teeth start to move?
Correct. Just last week, we had a patient in our office, and she'd come in, and when I sat down to do the exam, she told me just how thrilled she was that she came to see me about a year ago. And we did the laser procedure on her. And she said that her gums had filled in. Now, I questioned it because I didn't remember what her teeth looked like before, but we'd actually taken a photo. When I looked at the photo, she was right. She had spaces between her front 4 teeth. And she was told that she was going to lose all 4 of those teeth. She came to me, we did the laser, and just last week, her teeth had actually shifted back together. It almost looked like we'd done orthodontics on her.
All right.
Her smile had improved, and I wouldn't have believed it if I hadn't seen the picture myself.
What?
No.
No?
The non-surgical pocket reduction is called root planing. The surgery...
Periodontist or a general dentist argue and say, I don't know, that there's not enough evidence that these lasers work yet. Could somebody say that?
Well, somebody could not say that there's not enough evidence that the lasers work because we have plenty of evidence.
But do they say that? Do they say that?
Oh, absolutely. There are many dentists out there.
I
And
spoke
even
to a Dr. Heller, as a
matter.
matter of fact. He says, Randy, there's not enough evidence yet.
Yes.
At least for him.
Yes. People do still say that, but if you go and read the research articles very carefully, the research is there. I was actually one of the ones who was on the fence with this laser treatment for a long time. I was skeptical because we as periodontists, we are trained to be very evidence-based. We are trained to be very research-oriented. But nowadays, there's so much research out there on this topic that is very convincing. As a matter of fact, respected clinicians like Dr. Stephen Brown from Philadelphia or several of the periodontists who are on the board of directors of our governing body, which is the American Academy of Periodontology, are using lasers. So more and more periodontists are evaluating the research and seeing that it has shown to be effective and basically starting to incorporate lasers into their practice. Number one, there are different types of lasers. So a lot of the lasers that general dentists have may not be suited to treat gum disease. There are lasers that are specifically done because of the specific wavelengths of the lasers that have specific protocols to treat the gum disease. As a matter of fact, you have to have special training in order to be able to perform laser gum treatment. So not all lasers are alike. That's the first thing.
So the conventional method of treatment was, how do we get rid of this pocket so as to make it easier for the patient to clean? So if this was the pocket, the only way to get rid of it was either to cut it off or move it down. What does that do? Well, it gets rid of the pocket, but what it also does is it leaves the patient slightly disfigured. You have long, sensitive teeth. You've got teeth with spaces between them.
But that's how it's being done every day today. Is that right?
As we're speaking here, it's being done in thousands of offices across the country.
And that's cutting it out, cutting out this infection.
Cutting it off or cutting it out, one or the other, however you wish to say it. The fact of the matter is there's nothing intrinsically wrong with the idea of doing surgery, but there's a much better way, because the surgery is treating the effects. It's not treating the cause.
And the cause is a bacterial?
The cause is bacteria.
Okay.
Never forget the fact that the bacteria are the cause, and that is the reason why the laser gives us options that we never had with the more traditional, I like to say, antiquated therapy.
And now when you talk to doctors about this, because I guess in your field you are the gum specialist, the periodontist, right? Is that right? It's divided, right? Some say, you know, because I look anticipating this interview, some of the periodontists say, Randy, I'm not ready yet. I'm not ready to do it. I don't know if there's enough evidence. I don't know if it works, they say.
We're heavily divided. Okay?
So does it work? Let's start there. It works.
It absolutely works. First of all, not only does it work, and I can talk to you about the clinical results, but it works because we have research evidence published in refereed journals read across the world that say that this works. So there no longer can be any doubt that it works. Someone could have a different point of view.
Do you do surgeries anymore? For pocketing?
I'm going to give you a statistic that's probably going to knock your socks off, okay? In the last almost 2 years, I have not done one flap surgery, and flap surgery is the traditional surgery.
For gum disease?
Flap surgery for the sole purpose of eliminating pockets.
A pocket.
I haven't done it once in the last 18 months to 2 years.
You just
there's a reason for that.
So you just use the laser?
I use the laser. I use the laser routinely for a number of reasons, most important of which is it attacks the cause. It attacks the bacteria. The fact of the matter is that laser energy, light energy, all it is light, has a fantastic ability to be attracted to colors. And the fact of the matter is that the bacteria that cause periodontal disease have 4 colors: red, yellow, orange, and black. And so the laser energy goes right through the tissue, deep into the tissue, kills the bacteria with no collateral damage to the other tissue. So it's safe, it's effective, it causes the bacteria to be killed on the spot. Consequently, when we get rid of this bacterial activity, the patient's own ability to heal takes over. And we don't have any of those side effects that I spoke of before.
Now, what about pain? When you compare the two pain-wise, I mean, what do patients say? Because you got the laser therapy, and then you have the traditional cutting and stitching.
Once again, absolutely no comparison.
Really?
The routine for me over the past 25 years or so, first of all, I've been teaching this. I still continue to teach surgery because one needs to learn the basics. But over the past 20, 25 years, it was routine for me to prescribe narcotic analgesics for patients. Sometimes they had swelling and discomfort for a number of days.
With traditional surgery?
With traditional surgery.
Gum surgery, okay.
If we were doing it in more than one area of the mouth, they didn't want to come back and have it done again. So we went to doing it full mouth, which made it even worse for many people.
Very painful.
Yes.
So the laser?
This is entirely different. Entirely different.
Okay.
I have patients, I call all my patients the night after their surgery. Routinely, they're telling me, oh, yeah, I took a couple of Tylenol. Yeah, one tells me I had some Advil. That's the most, and they're done by the next morning.
So you just go around with a laser, zap it out. I don't want to oversimplify it, but you're like killing the bacteria.
That's right.
And the bad breath goes away.
In
Is
fact,
that right?
Sure. We fix the problem, and you change the person.
Good.
Fix the problem, and the person comes out of the shell. And I want to tell you, that is what really gets me up in the morning. That is what's reward.
You love this.
I wouldn't be doing it as long as I have and teaching as much as I do and spreading the gospel, and I hate to use that terminology, but that's what I'm doing. Spreading the gospel of a technology that's available today to everyone that is without comparison. And by the way, it's important to know that not all lasers were created equal. Physics is different. There is only one laser that is FDA approved and a patented protocol for treating periodontal disease. And the only one is the Periolase laser. That's the only one that has been approved. That's the only one that's been researched. That's the only one that will do the kinds of things that I've been talking about. There are many different lasers that will do many different things, some of them destructive. Those are not the ones we want to be using. So you go and you want to ask, does my periodontist have a laser? And if he has the laser, make certain that they've got the Periolase laser, because it's the only one that has university-based studies proving that it works.
And yes, we do have a link between all these bacteria that's inside the mouth. It's a direct connection because of
if you have blood in your mouth, it's going into your bloodstream, right?
Yes, communicates, exactly. So
interesting.
What we have is all this inflammation going to different body parts. So there's a direct communication with patients with cardiac issues.
Were you skeptical? Because look, I've talked to periodontists.
Absolutely.
They are divided, it seems like.
By nature, I'm skeptical because I always want evidence-based
Because you're trained in surgery, is that correct? To get rid of gum disease.
I've always looked at evidence behind anything I offer my patients. So this, initially, yes, I was skeptical, but the research is out.
Is there science behind this?
I mean, when we first adopted the traditional approach, there was one paper, one of one. You know, the periodontal therapy with lasers, there's a lot of research.
You've been a periodontist practicing for over 11 years.
Yes.
Okay. When you, back then, would you have poo-pooed this and said no?
Absolutely, yes. And I did. Because lasers have been out for that long. But the research obviously was weaker back then. And now with, just like anything in medicine, things develop.
I had a hygienist tell me, by the way, recently. She goes, the lasers don't work. They even could burn the roots of your teeth. So what do you say to something like that?
There's no truth in that. I mean, there's plenty of research
showing
showing that they do work. There's plenty of research done correctly, like anything else that we do. It needs to be employed correctly.
So no more bleeding gums, bad breath, you get stronger teeth.
Stronger teeth, and hopefully save your teeth.
The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. This is where bacteria live and build a neighborhood of its own that destroys healthy gum tissue and bone that holds your teeth in their proper position. There are specific germs and bacteria that cause gum disease. The Periolase laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. The laser tip is then removed from the pocket and set aside. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. These instruments use sound waves to vibrate and break apart the hard mineral calcium deposits, with water flushing away the debris and cooling the instrument tip. Some hand cleaning instruments may be used at this time to remove any remaining hard calcium deposits. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back.